How broken is our healthcare system? Let me tell you about my week. And we're going to do this in 3 parts because, well, it's been a week. Client number 1 is recovering in rehab and ready to be discharged back home. As soon as he went to the hospital, I talked to the family and advised that it might be time to look at assisted living instead of independent living. I'd been seeing him every week or two, filling his medication boxes and managing all of his health care. He had recently had a few falls and was having trouble remembering to take his medications at the right time, so it seemed like a transition to a bit more care was warranted. The independent and assisted living are both in the same location, so we didn't have to find a new facility. We just had to coordinate the move from one apartment to another, and family had to sign a new contract. At the beginning of last week, it was determined that it was time to transition him out of rehab. I arranged for a move manager to come in, pack up his independent apartment, and get him set up in his assisted living apartment. We were all set for a Monday morning move and a Monday afternoon discharge. The client was really anxious to get out of rehab and back home, as you can imagine. I confirmed on Saturday that the assisted living was ready for him. Early Monday morning, I sent another confirmation and let them know the packers would be there soon and the movers would be there at 9 o'clock. And that's when the wheels came off. At 9:30, I got a message saying there might be a problem with the discharge. Now, when you leave the hospital or rehab and go into assisted living, even if it's within the same facility, you have to have a couple of assessments completed. A provider has to do what is called an 1823, and a nurse from the facility has to do an assessment as well. These are done to make sure the facility can provide the appropriate level of care for the resident. We certainly don't want to put anyone in an unsafe environment. These were completed at the end of last week, and to the best of my knowledge, everything was okay. As a nurse and healthcare advocate that's been in many assisted living facilities, I didn't see any red flags and thought my client was appropriate for assisted living. Apparently, at some point, the facility nurse decided my client was not appropriate for assisted living, and I was told that if he had additional 24/7 care, he could move in. As you may know, assisted living is not cheap, and Medicare doesn't cover any of the cost. So on top of the monthly cost, they now wanted this gentleman and his family to pay for an additional 24-hour care. That runs on average $18,000 to $25,000 a month. So where are we now? Like always, what do we do when healthcare goes awry? We pivot. We've found a new assisted living facility, one that I've been in frequently, one that I know and work well with the director and the staff. Contract is in place, new assessments are scheduled, our amazing move managers have him rescheduled, and our plan is to have him settled in his new place by Wednesday. Oh wait, I forgot to mention that his family was out of town this week and they were 6 time zones ahead. I say it all the time, we have amazing providers in this country. Our doctors, nurse practitioners, physician assistants, nurses, therapists, we can do amazing things in medicine. But our system is broken, and that's why we do what we do. We might not be able to fix it, but we help manage the situation and bring peace of mind to families. They can rest assured that someone who knows the system is looking out for their loved ones, even if they're 6 time zones ahead. Follow along for part 2 this week. Sometimes I have to shake my head in healthcare, but sometimes I have to take a stand for what is right.